everyone, and welcome to the second part of the session about design and healthcare. And here I'm Paolo Ciuccarelli. I'm the founding director of the Center for Design here at Northeastern University, and I'm really just introducing the team. It's a joint team. It's a joint collaboration between universities, not just different disciplines, but also different universities here collaborating around design and health. And so we join forces with a Politecnico di Milano that is working on the same relationship, so design and healthcare with a human-centered perspective in the Milano area. And so we created a joint initiative to compare, in a way, the two different ecosystems and all the actors that in the two different areas, the Boston area and the Milano area, are working on solutions and initiatives that really put the patient at the center of all the solutions and the services. How this is happening, it's what you will hear in this minutes from the different participants. Estefania, Miso, Stefano, introduce yourselves.
Yeah. Thank you very much, Paolo. I think now it's my turn. I'm Stefano Maffei. I'm also here by the Center for Design. These fantastic guys here. I'm a professor of design at the School of Design in Politecnico di Milano, and I'm really happy to be here to talk about this collaboration. We started looking at the idea of empowered patientship. What is the empowered patient? Why it is so important discussing this? I think that just for following the previous presentation, we understood that during the pandemic, there was a huge impact in healthcare systems. This was due by the fact that there was this great pressure made by this huge mass of patients that were not listened, because they were like part of the system, but they were not just included in the system. They were not participating in the definition of the processes they were involved in as a patient. So this thing is probably one of the most important things that we have to, let's say, learn from this emergency. And I think that it's just for that we started the collaboration, just to do an inquiry about how these healthcare ecosystems are taking into account the patient role. And I think this could really be a discussion about the impact of this user-driven perspective. If we could move on in this discussion, we could see, next slide please, that there is a complex evolution going on in the ecosystem. They were affected by this process of digital transformation, of changing the roles. There is this emerging idea of these personalized healthcare processes, let's say a kind of high-tech dominated by technology vision of what healthcare is. And I think that we have to put, as usually design does, the user, so the patient at the center of our discussion, discovering the needs, discovering the background, the context, the emerging problems that they have. So starting from that, obviously the idea is also to bring in two different takes on the problem, because I think that US and Europe have really differences in this perception of the role of the patient, in how these ecosystems are made, starting from the research system towards the, let's say, the medical system, and also finally also discussing this idea of welfare, because I think again that there are huge differences in that. And starting from this different, next slide please, we decided to understand what is this patient innovation. That's because I think that the patient is not only the center or the, let's say, the most important protagonist of this relationship, but it's also a source, an impactful source of innovation. We usually consider innovation only coming from a market-driven perspective or from a technology-driven perspective, and instead we think that this is a systemic thing. So it comes, yes, from technology, yes, from the market, but for sure it's made also by the people that are doing this. So on one side, the researchers, so just to say these teams, just to make an example, and on the other side, instead, is just the user, so the people that are involved in the solution. So next slide, please. We decided to join the forces. So we built this integrated, let's say, research team in which there is on one side Politecnico di Milano team, School of Design, and on the other side the Center for Design. I'm Stefano Maffei, Massimo Bianchini and Beatrice are my colleague in Milan, and some of the protagonists are also here, so Paolo, Miso, Estefania, and Michael that was presented before. Next slide, please. Just a very short introduction of which is the nature of Politecnico expertise. I'm part of a research group that involves, on one side, a makerspace, Polyfactory, this is the makerspace of our university. On the other side, a service design research group that also produces a specialized service design master. And on the other, the third leg of this system is the design policy lab, just because we believe that this change is happening not only in physical products, but also in services and even in policy. Next slide, please. Yes, this is just an image of Polyfactory. If you pass through Milan, please come and visit, because I think it's an interesting interactive place in which we are dealing with this small keyword: circular innovation, open innovation, patient user innovation, social innovation, open and distributed design, and service design. Next slide, please. And I mostly invite this fantastic bunch of guys, and they will introduce themselves by themselves. So, yes. Next slide, please. During the design week, it's a fantastic thing. So the focus, as Paolo was saying at the beginning, we're trying to map this patient innovation in these two ecosystems. Let's say metropolitan urban ecosystem, Milan for sure, and Boston area. And the discussion will be also if we want to limit this to the urban area, or we want to expand to the region or the states, that's to say the country, Italy, or Massachusetts state, or US, it will be a further decision. Next slide, please. And we started from an idea that we developed in Italy that was coming from the analysis of, let's say, more product-oriented patient innovation. This research was called Make to Care. You could find some report online, and was funded by a big pharma company, Sanofi, and Sanofi Genzyme, is a famous brand that have also one research lab here in Cambridge, in Boston. Just to say that, next slide, that we let's say use this idea of an ecosystem, an exploration of ecosystem that was involving actors and projects, and this is exactly the activity that we are doing now. So searching for practices, let's see together which are the most promising emerging cases that are telling us something. Usually we talk in design, in service design, about, let's say, bottom-up innovation processes. So things that are happening in individuals, using the creativity or the talent coming from individuals or community. I think that probably healthcare and care in general are really, really affected by this kind of innovation processes. So we want to analyze before which are the main drivers, as I was mentioning before, let's say digitalization of things. Or, for example, this idea of the reform in welfare system that cut, let's say, cost of healthcare, a solution provided by the state, just to make the example in Europe. So pushing a lot in terms of innovation, what we could change just to produce the same effect, the same performance with lower cost. And starting from this idea of mapping cases, we will generate, let's say, an interpretive model that will help us in, let's say, understand better which is the source of this bottom-up innovation, the sources, and also to understand how we could use this emergent driver to produce something different, a change and transition that could be connected also to this idea of climate change challenges, because as we know, product, services, and also policies have externalities. So they could produce impact in their process of development. Next slide, please. These are just numbers, just to see that we started doing an info visualization. This, in my opinion, another of the most important assets of the Center of Design. So I think that Miso and Estefania and Paolo could say something about that. Next slide, please. And this is the final representation. We want to produce, let's say, interactive maps and mapping, and through mapping and qualitative and quantitative analysis, understanding again better which is the nature of these two ecosystems, and then eventually intervene in product, services, or policies, let's say, to push for a transition that, in my opinion, it is necessary. Next slide, please. And now is the Boston turn and the Boston story.
Sounds great. So I will make it short because I saw that we have 5 minutes left. Perfect. So we are in the process of mapping right now. We didn't create the website, but that's our plan by the mid-summer. And we collected so far about 50 cases. And then as a way of doing that, we mostly relied on online search with a couple of keywords, but we are also partnering with Medco, Boston's famous experience design agency specialized in healthcare. They kindly invited us to participate in their healthcare experience design conference a few weeks ago. Last week, was it? Yeah, and then we had the chance to survey the participants about what are the existing cases of patient-centric projects. So as the outcome, we are starting to find some interesting pattern in the Boston area. For example, we find many cases of digital services. Another pattern that we find is that we find a lot of health, environment-related design, especially in relation to the building designs of the hospitals. And another characteristic we find is that we find a lot of public services like policies or certificate program, as you see here. From here, our future plan is to develop a metrics of what are the factors, patterns, and then different dimensions of what constitutes patient-centeredness. And from there, we want to identify opportunities and strategies for healthcare design for the future. And in order to do this, most importantly, we want to secure funding and find partners for patient innovation initiatives in the US and Italy. So these are some of the questions that we are going to explore along the way of our research. What is patient-centeredness in healthcare? What are some current problems people experience with healthcare? And what does your ideal future patient experience look like? So if we had time, we were going to bring this into discussion in this session, but since we are running out of time, we also prepared for that too. So we have the short URL there. So if you could please participate in the survey, we would really appreciate your support and help. I'm going to copy and paste the URL at the end of this presentation. So yep, that's all we have for today. Thank you so much for your help. I'm going to put the URL in the screen. Thank you. I hopefully met the time.
Thank you guys so much. Yes.
Yeah, if I may add a comment after that, putting the user at the center, patient-centeredness is something that we read in, I would say, most of the websites of all pharma companies, all providers of healthcare services. But indeed, in practice, there is not much about that if you look at the really how people are treated within the system. So it seems something that it's there. So you may say, if you read the websites and if you hear what all the companies especially say about that, you may think it's something that is there. But then when you start dealing with the patients and you do surveys and you just look around what's going on, there is still a lot of work to be done. So that's what we're trying to address here with this initiative and learning, especially from other systems where there are experiences around services that speaks more, about dignity and the human, the importance of the human in the loop, so to say.
If I may add something, Paolo, I think that you are addressing this kind of, let's say, let's do this comparison. It's like greenwashing, it's patient washing thing.
Yeah, that is a kind of a patient washing.
Let's call it patient washing.
Patient washing.
Yeah.
Okay, sorry.
I think we are perfectly on time. This is exactly 2:30 p.m.
Yeah.
Thank you.
Thank you. I mean, patient washing sounds so interesting, but we'll save that for another talk. All right.
Okay.
Thank you guys so much. Big claps.
Thank you.
Great.
All
Thank
right.
you. Thanks for coming.
Thank you.